one thing.
Okay, and so what's the one thing you want people challenged by pain to know about?
Hi, so David, first of all, thank you very much for this initiative. I think it's a great thing to do, and I'm very happy that you invited me to be part of it. If you ask me what I want to tell people who are suffering from chronic pain, I think the one thing that I want to tell them would be face your fears. So of course we know that fear of pain, fear of re-injury, fear of movement, and the associated avoidance behavior, that they are important key contributors to the development and the maintenance of chronic pain. But we also know that these protective behaviors, although they are important in the beginning to promote healing, tissue healing, and also to promote recovery, that they may paradoxically actually lead to worsen the situation. So if you are afraid of moving, of course you avoid it, and you do this to reduce the fear you feel. But we have shown now in a series of experimental research that this may actually worsen the situation, that actually it maintains your fear, it may even worsen your fear, and it also maintains the threat beliefs or the harm beliefs you have. And there are several mechanisms that may be involved in this. One thing is consequential reasoning. That means that you can actually use your own behavior to infer threat. So the reasoning that you then have is, well, I'm avoiding this movement, so it must be painful, or it must be harmful for me. So, and this may actually maintain the beliefs you have. The second thing is that the avoidance behavior may also generalize to novel situations, which are actually not threatening for you, or may not cause harm. So, and of course, to a certain degree, this generalization is of course adaptive, because if you had hurt your back when you lift up a very heavy object, it's of course reasonable that you also are careful when you lift up other heavy objects. But if you start generalizing this behavior to very safe movements, this may actually become problematic. For example, if you're also afraid to pick up your paper in front of your doorstep, this possibly may lead to increase this fear and maintain this fear, and this may actually become maladaptive. It reduces your activity level, and this may lead to disability. So basically what I'm trying to say is that I think that learning about harm is important, but learning about safety is as important. And what we have shown in our research is that people who suffer from chronic pain, that they actually show impaired safety learning. So that they are worse in picking up which activities or movements are actually safe. And this then can lead to overgeneralization, like I just described, and this may be a maintaining factor in disability. And then the last tricky part about avoidance is that it's also self-sustaining. Of course, if we avoid, we will never be able to disconfirm whether this was now necessary or not. So if you have avoided a movement and nothing bad happens, well, yeah, you think that it was necessary, but you will never be able to find that out. So safety is attributed to that avoidance behavior. And this, again, may paradoxically continue this vicious cycle of fear and avoidance. So to wrap it up, I think if I would have to give one message to people with chronic pain, I would say face your fears, and know that fear can lead to discomfort. It may not be a nice situation to be in, but it does not lead to disability. In order to become disabled, you also need to avoid the things that you're afraid of, and that needs to generalize to a lot of a very broad range of situations. So challenge your thoughts, challenge what you think that might worsen your pain, or that what might lead to harm, because violation of harm expectancy and also breaking this cycle of avoidance behavior may be the key to recovery.
Yeah, that's really great. It sounds like so much of this is learned. It seems to be easy to get caught into this fear, avoidance, learned behavior, but can we use learning to undo it, I guess?
Yeah, that's a very good question. So first of all, indeed, learning can occur very, very quickly. And the sad part is that there's actually a dissociation. So you could say to acquire this fear, it could already occur after one trial learning. If it's a very intense situation, if your painful episode is, or your injury is very traumatic, it might occur at one trial learning. And the dissociation occurs when you will look at whether you want, when you want to unlearn fear, because it seems that these initial associations occur very quickly, but to unlearn it, it's very difficult. And also, I don't really like the term unlearning, because at this point, I think the current learning theory would say that you never unlearn something. You can only learn that there is an exception to the rule, and you would need a lot of experiences with the exception to the rule to actually start behaving in that way. And that, of course, makes sense, because if something is potentially dangerous, you want to be careful, and it takes longer to learn that something is safe. So like what I just said before, and unlearning something in the current learning theory would rather be learning that something is safe again, right? So it means that you would learn a new memory or a new association between a certain movement and safety, and the context or how many times you have experienced that this is actually holding, that will then eventually hopefully lead to the fact that you can that you start to behave in that way. And this has been used before already in clinical practice, because extinction learning, this is what we call unlearning of fear. This is basically the basis of exposure therapy. So this is also what we have been trying to do in the clinic with patients. It's facing their fears, like I just said. So the movements that they are afraid of, we let them, in little behavioral experiments, we let them actually conduct or perform the movements that they're afraid of. And we try to actually show them or disconfirm the harm beliefs they had. So if they think that something in their back will snap when they lift something heavy up, we say, well, we think it will not, so go ahead and try it. And as if they get a lot of disconfirmation of these threat beliefs, then hopefully they will be able to overcome those.
Great. Well, thank you so much for your time, and it was really nice talking to you. It was brilliant. Thanks so much.
Yeah, thank you very much, and enjoy your evening.
Thank you.
Bye.
We'll talk to you soon. Bye. And you've got your day starting out, and we're wrapping up our day here in Sydney, so enjoy the rest of the day.
You're at the better end of the time zone now.
Yeah.